Micromanagement of daily practice has become a thing of the past for me. There are no contracts, authorizations, denials, appeals, reviews, forms, IPAs, HMOs, or PPOs. Our division's billing overhead is 1%. My relationship with the hospital administration is defined by professional, not financial standards. I have no allegiance to any corporate or government entity, nor does one ever get in between me and the patient. This environment, which some denigrate as socialized medicine, allows for more patient autonomy and choice than was available to most of my patients here in California. That is not at all to say that I practice in a medical utopia. There is no perfect healthcare system. The Canadian system has its own set of difficulties, challenges, and shortcomings, and Canadians are also looking to significantly reform their system. But as physicians, we have to enter the debate, and we have to enter it objectively, salvaging it from the bias, misrepresentation, and demagoguery that has characterized it. Healthcare is not, should not be a liberal or conservative issue. For disease, disability, and death do not recognize political affiliations. As a socially conservative Christian myself, my belief is that healthcare is a fundamental human right, and my efforts on behalf of single-payer universal health coverage stem from my faith and not despite it. My faith calls for personal morality, but also for societal morality. How do we treat the sick amongst us, the weak amongst us, the least amongst us? The healthcare environment in the United States contains all the components of a stellar healthcare system. Well-trained physicians, superbly equipped hospitals, the best research infrastructure in the world, more than sufficient capacity, resources, and funding. Throughout the country, we have many islands of what is truly the best healthcare in the world, one right here at UCI. But we have not been able to integrate those components together into a healthcare system truly worthy of this nation. Our public health outcomes and some of our tertiary outcomes lag behind most industrialized democracies. We have left too many people behind. Too many people go bankrupt. Too many people suffer. Too many people die. About 20,000 a year because of lack of access. And while many are left behind, others are excessively treated. In a landmark article published last year in the New Yorker, Dr. Atul Gawande found that the per capita expenditures of Medicare patients in the small town of McAllen, Texas is double the national average, even though these patients were no more sick than their counterparts in other areas of the country and had no better outcomes of care. Dissection of this phenomenon revealed the reason to be that patients received care that benefited the physician and the hospital, not the patient. In McAllen, medicine had become a huge industry, not just for the hospitals, but also for the physicians. Unfortunately, McAllen medicine is prevalent throughout the country. It is part and parcel of what Dr. Tom Russell, the former executive director of the American College of Surgeons, lamented as the corporatization of medicine. Quote, "Unfortunately, the practice of surgery today is as much a business as it is a science and art," end of quote, he wrote in one of his editorials. This corporatization is pervasive. Too many physicians are resigned to it. Too many have yielded to its power. Too many have been seduced by its promises. It has resulted in many of the lapses of ethics and judgment that you fought against as students. Let's be honest. Wall Street needs to clean up its act, but so does Medicine Street. The fight continues ahead, and in it, your enemies will not be administrators, insurance companies, pharmaceutical companies, or the government. Your enemies will be much more potent. Apathy, indifference, loss of vision, loss of purpose. Do not be distracted. Do not let up your fight, for we need you. We need you in a time such as this. Be significant to your country. My parents sacrificed much to send me, their only child, to America at age 17 to start college. They believed, as had millions before them, that in the US I would enjoy equal opportunity and equal citizenship. My acceptance to North American medical schools while I was still an international student was near miraculous. I have never taken for granted the opportunities I have enjoyed and the positions I have attained, for I most certainly would have been denied those in my native land. My story is an American story. No doubt the story of many of you who will receive your medical degree today. the story that continues to make the American experience the most profound in the history of mankind. In many ways, though, I am an improbable commencement speaker. I did not cure a disease or invent a drug or device. I did not start an organization or win an international prize. The only reason I'm here today is that I was able to tap into a deep desire to do good in these young physicians. But I am really just another physician trying to balance an academic surgical career with family obligations, struggling to maintain a healthy physical and spiritual life through an extremely demanding professional path, and often falling short. My challenges will soon be the challenges of these new doctors. And my hope, my wish for them, is that they will meet these challenges far more effectively than I have been able to meet mine. And in this task, they will need you, their spouses, their parents, their siblings, their friends, their loved ones. They will need you to believe in their mission, to make it yours as well, to support them, to understand them, to be patient with them, to share in their lows and to celebrate their highs. And they will also need you to remind them to take care of themselves and their families. May God bless these new doctors, may He shed His light upon them, and may He endow them with the very best in their professional and personal journeys. Thank you.
Thank you, Dr. Emil. That was wonderful. Like you, I look forward to the day that healthcare is a right and not a privilege in this country. We'll now have the address of the senior